Heart Association estimates that 92% of all sudden cardiac arrest victims die before even reaching the hospital. These statistics could change and more lives could be saved if more people knew CPR, or cardiopulmonary resuscitation. Immediate CPR can double or even triple a victim's chance of survival. When I was 14, I first became CPR certified for a safe sitter class to be a babysitter. 10 years later, it's required for my job at an assisted living facility to be CPR certified, which is why today I'm going to talk to you about and demonstrate the assessment of CPR, the step-by-step instructions of CPR, and hands-only or compression-only CPR. Before approaching a victim, first look around and make sure the scene is safe. Once you know the scene is safe, approach the victim and check for responsiveness by tapping their shoulders and shouting, "Blake! Blake!" You tap the shoulders because it causes the least amount of movement of the victim. If you realize the victim is unconscious, you immediately yell for help. The help can bring an AED machine and a barrier device. If no one is around, you will have to call 911, which may require leaving the victim. 911, I have an emergency. After dialing 911, check the victim to see if they're breathing by watching their chest for 5 to 10 seconds for movement. If the victim is breathing, check them for obvious signs of injury or trauma. If the victim is not breathing or gasping for air, immediately begin CPR. First, I'm going to demonstrate mouth-to-mouth or regular CPR. This should only be performed on close friends and family members. If you don't know the victim, we'll talk about regular, compression-only, hands-only CPR later. First, remove any clothing covering the chest of the victim. Then, prepare for compressions. Take the palm of one hand and place it in the center of the chest between the nipple lines on the breastbone. Cover with your other hand the first hand. Lock your elbows and make sure your shoulders are over the victim's chest. You'll begin compressions 2 inches deep at a rate of 100 compressions per minute, or to the famous Bee Gees song, "Staying Alive." After you've done 30 compressions, prepare for breaths. You'll be giving 2 breaths at least 1 second in length each. First, you'll do the head tilt chin lift. You'll take 2 fingers and place it under the victim's chin. With your other hand, you'll tilt the head back towards the top of the victim. You'll squeeze the nostrils closed and giving 2 breaths, watch for the chest to rise. After you give 2 breaths, continue compressions at a 30 compression to 2 breath ratio. Continue this until the victim becomes conscious and moving, or until help arrives. If you don't know the victim, it's recommended that you do hands-only or compression-only CPR. This is exactly the same as regular CPR, but you don't give any breaths. Begin by removing any clothing covering the victim's chest. You take the palm of one hand and place it in the center of the chest, in between the nipple line, on the breastbone. You cover with the other hand, lock your elbows and make sure your shoulders are over the chest of the victim. Then you prepare to give 2-inch deep compressions at least 100 compressions per minute, or to the rhythm of the famous Bee Gees song, "Staying Alive." doing compressions until someone comes to switch with you, or until the victim moves, or until help arrives. Today I've demonstrated the assessment of when to do CPR, the step-by-step instructions of doing mouth-to-mouth or regular CPR, and hands-only or compression-only CPR. To find out how to become CPR certified, visit the American Heart Association at www.heart.org. Or to become certified in the Northern Virginia area with who I got certified with, visit Virginia CPR and First Aid at www.virginiacpr.com. The American Heart Association estimates that 88% of all cardiac arrests happen at home. Simply put, knowing CPR most likely will save the life of someone you love. So stay alive, people.